because I'm huge on educating people with what they're getting, why they're getting. If you have a concern, we try to address the concern that you have, and there are multiple ways of doing it. So it is just kind of keeping you informed of what's new, what's out there, what's good, what may not be so great, but just giving you your options and your choices. Just some updating. So for the Wellness Center, we do have some new and exciting trainers that are going to be coming on. So we will be we're going to probably take, what is the first 20 people? Is that what it is? So we're going to have a free fitness training session August the 20th from 9 to 10. And then you can meet some of the trainers from 10 to 11. But it is for the first 20 people who sign up. So I remember I told you, we're trying to treat the whole person. So we have trainers, we'll have different fitness classes. We still are looking for more yoga instructors. We do have one yoga instructor so far, but we want to have a variety. We are also looking for massage therapists as well. So if you know someone or you are someone who is a really good massage therapist and you know that you're really good, because it's really important to have good massages, call us. We are still interviewing for massage therapy positions as well. Um, also, August 12th through the 14th, we would like anyone who's in the area, or if you're just downtown or you just want to come and see us, we will be at the Black Women's Expo at McCormick Place. Our booth is 1251. That's going to be August 12th through the 14th. The times, I want to say, what are the times? It's from 10 to 7. Friday, Saturday, Sunday, I think is 10 to 6. So meet us down there. Come by, see what's going on at the Black Expo, Women's Expo. That's this coming Friday, Saturday, and Sunday. And the address is 2301 South King Drive. And remember, we are at booth 1251, so 1251. So today's topic. So all the housekeeping is done. So I've done my job with that. So today we are going to be addressing some skin treatments, some volume reduction treatments, some overall anti-aging things that we can do. So this month we have the HydroJelly Mask. So this was something that was really popular probably right before COVID, but it still really works really well. There's a lot of TikTok videos that people were doing. I think we have a video out there as well, so you can actually see what the HydroJelly Mask looks like. But this is actually coming with a facial. So we do a full facial plus the HydroJelly Mask. And we have so many different types of masks that you can do. There's probably about 12 different ones. There's an antioxidant goji mask. It's an antioxidant that helps with brightening, firming. There's super green strength that has organic kale, spinach, um, phytonutrients. Um, there's so many different. Well, there's a Belgium cacao, which has omega-6 fatty acids, Himalayan white tea, which is the one that I have here. So we have a lot of different masks that comes with a facial. It's a relaxing mask. It's also a fun mask. We have a lot of 20-year-olds, some of our teenagers get it, even people who are my age, and I won't tell you my age today, but we get it as well. It just helps with so many different options. But we are also talking about today the dermal fillers. And we have added more lines for the fillers that we have. So we also have Juvederm, we have Restylane, we have Sculptra, which is a little bit of a different type of filler, but we'll talk about in a minute. We also have Kybella, which is not exactly a filler. it is more of, it dissolves fat. So a lot of people will do it for small areas. So like their chin. I've even had some people do it for, and this is off label, but you know, if you have a little small pouch that's right here and you want that gone, you can off label use Kybella to do that, as long as it's not a large area that we have to treat. But Kybella actually helps to dissolve fat cells. So let's get started with some of the fillers. So what is a filler? People do it for different reasons. A lot of people will do it because they're starting to see lines, mainly in this area here that's called your nasolabial folds, and as well as here, which is called your marionette lines. So they don't like the lines, and most of the time we see this because we are losing volume. So in your 20s, you've got perky cheeks, they're all full and nice. And a lot of people, when they come in, they say, I just want my face to look like this. I want it to be lifted. Okay, different fillers will do different things. So we have fillers that do more of lifting. So that's going to be your volumas or your contours. These are heavier lifting fillers. So what we do is replace the volume that you have lost in this area. Once again, your back pads are usually in your 20s. They're all cheeky, look great, firm, sits up nicely. Well, as we start to get older, we lose collagen volume every year after the age of 25. I know that sucks, but we can do things that actually help improve it. People are concerned when they come in. I don't want to look like it's not real. So a lot of times when you see certain people who look like they're really, really full here and that's not, doesn't look as natural to you, we don't have to put 4 and 6 vials of syringes. So this is what a syringe looks like. This is the amount. I don't know if you can actually see it. I'll open it up so you can see it a little bit. But this is what a syringe looks like. Most people, that's how much is in the syringe. This is probably about a tablespoon. So you don't need a huge amount to do corrections. Most people will say for every 10 years after the age of 30, you need 1 syringe. So if you are 60, you might need 3 to 4 syringes. But I don't always start there because everyone doesn't need to have that much volume placed to give you more of a lift. This is also another one. This is more of a calcium product, and you can use this in multiple places. So when you come in, we actually have a kit that we use. So you can actually feel what the different types of fillers feel like. The ones that are do more lifting, they need to be a little heavier because we're trying to lift this area. So we actually do lifting more in this area here because if I feel you here, it'll lift you here. If I feel you here, it'll lift here. I feel you here. So yes, what you're doing in the mirror, I just want this lifted. This is what these do. They will lift that area. For the areas around the nose, the areas around the mouth, those things we can actually do a softer filler because you don't want a lot of volume in this area here. We have some fillers where people have shorter chins, and so they want to have a more prominent, softer chin. We can do that with filler. We can even do lifting. So if you've got, okay, the jowls is what people call them. So if you have that kind of sitting here, there are certain things we can do with filler to lift that up so that you don't see as much of the volume. It's inevitable. As we get older, we just lose the collagen, and we don't lose it just in the face, we lose it everywhere. We are also providing or offering, it's called sculptures, because we talked about that a little earlier. Sculpture is a little different. This is actually a collagen restoration filler device procedure that we do. So it also we mix it, but we actually inject this like we do the other fillers. This is going to build much more collagen. The difference between Sculpture and the other fillers is that with Sculpture, because it is meant to rebuild a significant amount of collagen, sometimes depending on how much you're trying to do or how much volume you've lost, you may have to do 1 or 2 sessions. And you may have to do those maybe 1 to 2 months apart. But what you see with Sculpture is that you don't see the initial large volume. And that is because it takes time to rebuild collagen. I don't care what procedure you're doing. So if you're doing a filler, if you're doing laser, if you're doing rejuvenation, wherever you're trying to rebuild collagen, it takes about 3 months to do it. It's about 12 weeks. Sometimes you may start to see things a little earlier than 12 weeks, but usually it takes around 12 weeks. Um, you see much more longer lasting results with Sculpture. So the average for most fillers, depending on what you're doing, if you're doing the fillers that are lifting, those are generally anywhere from to they say 2 years. I'd probably say 18 months, how long it will last. For the sculpture lasts for about 2 to 3 years, but it's a different process. These are going to give you volume. So if you are flat in this area and you're looking for a lift, or you have the lines here and you want something quick that is going to see the results almost immediately, that's these type of fillers. If you're looking for more long term and you're patient and you can wait for a couple of months to actually see the results, that's Sculpture. And so some people talk about doing BBL, so Brazilian butt lifts. So Sculpture is one of the products that most people will use for a Brazilian butt lift if you're not having liposuction. It's a lot of filler that you're going to be adding depending on how much volume you're looking for. So, I'm 50-50 on how much filler I'm willing to put in someone. But if you have small areas that have like an indentation and you just want that to kind of pop out, then Sculpture is actually an ideal option for that without having to undergo liposuction. Questions. I know I've just talked about a lot of stuff. Can I do a filler and HydroJelly mask on the same day? You can, but you have to do the facial first, and then we do the filler after that, because we don't want the filler being moved around. Because when you're normally doing a facial, they do a lot of massaging, which is relaxing. So we don't want the filler to be massaged. We want it to be where it is that we've actually placed it. So yes, you can do it on the same day. Are the fillers painful? Oh, so I forgot to tell you guys. Okay, sorry, I got a little excited. And I've had it for a while. So for people yes and no. It depends on your pain tolerance as far as fillers are concerned. So we always have people come in a little earlier than their appointment when they're doing fillers, because we do numbing topical. Also, the majority of these fillers have numbing medication and they have lidocaine in it. So it will numb you at the same time we're also doing the filler. We also do ice, but we also offer, wait for it, laughing gas. Okay, so laughing gas, and not, I've let everybody try this, so I tried it once. It works great. Most people don't remember it. It wears off, so you can drive yourself. And it is also helps with any type of pain. So if you're anxious about getting it, we do offer laughing gas. So you are more than welcome to puff as much as you like. It does wear off in about 10 to 15 minutes, but it helps you relax. And this process is really seamless. And then you come out looking about 10, 15 years younger. So yes, how long do fillers treatment take? Depending on the areas that you're doing, the procedure itself could take as little as 15 minutes. It could take up to 30. Average is probably about 30 if you're doing more of a volume replacement and lift. We also do lips. So some people will come in for lip filler. We generally don't like to expand the lips way more than what they should be, because then people start to run into problems where the filler actually goes in places where it shouldn't go. So we do lots of different areas with the filler. So once again, it generally about 30 minutes, but we usually schedule the appointment for about an hour. Okay. Yes. So the question is, does a filler help with aging hands? If so, which filler should I use? Um, so I, so the question is yes, it does help with aging hands. I personally like Radius for the hands, but we can use just about any filler that is going to, but a little softer, that we can kind of mold, and we will mold the hands when we actually use the filler. I don't know if you can see my hands. So as we, once again, there's that collagen that starts to leave you. But as we start to get older, we start to lose collagen. So you start to see more vascular areas. You start to see, and everybody's looking at their hands right now. So you start to see the vessels more. You start to see the tendons more. And it's because you're losing the volume in the hands. So I tell people things that give away people's age are hands, neck, because we take care of our face, but we don't do our neck, we don't do our chest and our hands. So yes, you can use filler for the hands. Good question. How often should I get a HydroJelly mask? So it varies. Most people will like to do it, especially if you like facials, once a month is a good time that people will actually do doing facials. Like I said, this is not, so it depends on which facial you're getting to. Some of them are a little bit less intense than others. It also depends on if you're trying to treat it. The one thing I always suggest is that when you are trying to do any type of anti-aging procedures, facials are a good place to start because it does do some exfoliation. So when you exfoliate the skin, it helps it to turn over, so that dead layer is coming off quicker and you're rejuvenating the skin. It's not as aggressive as other things like laser or plasma laser or deep chemical peels. Those are a little bit more aggressive, but it's relaxing. And so you can actually do it once a month. And it's just a way to treat yourself. And we have spa music that plays in the background. We have wine if you'd like to have wine. We do recommend hydration. So we have water too. So we have all those things. Okay. Any more questions that we have? So you can always text us, call us, inbox us, tweet us, all of those different things. If you have any other questions, I think Kathy did the month in view. So I think she mentioned, I think it's on special this month. I don't know what the special is. So the Hydro Jelly facial mask is $110, and that's with a general facial, and then off of the fillers, and we're going to throw in the Kybella for that as well. It is $75 off per syringe. So schedule your appointments. The kids are going back to school, so you'll have some time for yourself now. I get it. I have two as well. So it'll just be some time that you can actually kind of spend for yourself, because it's tough getting the kids back away from home. so come see us at our new location. Like I said, reminders, we're doing our free fitness class August 20th from 9 to 10. That's the class. First 20 people that sign up for the class, as well as 10 a.m. to 11, and then that's when we'll be starting. You can sign up for membership, you can sign up for classes that day, and then this weekend, August 12th to the 14th, come to our booth at the Women's Black Expo at McCormick Place. That is booth 1251. Address is 2301 South King Drive. Once again, our next broadcasts are Friday, September 2nd. That's when we talk about the health. So let's talk about your health with Dr. Clark White. That's at 2 p.m. Central Time. And then our next Talk with Terry Tuesday, dealing with the Wellness Center and Spa, is going to be September 13th. And that's going to be Talk with Terry Tuesday. I want to thank you guys for joining us. Remember, our new location is 7151 West 183rd Street in Tinley Park. And our phone number, still the same, but 708-864-4988. Now I'm going to go through all these social media things. If you have not already, please like us on Facebook, follow us on Instagram, now TikTok, and Twitter. Subscribe to our YouTube channel. Listen to our podcast on Spotify and Anchor.fm. And please share this broadcast. Yes, we have a question for in-house.
We do. A question from Tristan Scott Banks says, how do I sign up for the exercise class?
Oh, you can call us or you can see us on August 20th. But yes, like I said, we will have personal trainers. So if you want your own personal trainers, we offer that. We'll offer group training, private group training, class group training, and also classes. So we have 4 different tiers. For people who sign up with memberships, you will also have 24-hour access. And then we have some other things that go along with different tiers of the membership. But you'll have 24-hour access to the gym. So if you can't come to a class, you'll still be able to use the facility 24 hours a day. So total wellness in 2022. We have had a rough couple of 2 years. So this is hopefully going to start to propel us back to some normalcy. We will have nutritionists that's going to be coming up. We will have weight loss. We're going to be doing that as well. That's going to include medications, injections, offers for Noom. So different things that will actually try to give us some sense of normalcy. And once again, my motto is always, we are living longer, but not always better. So we're trying to do our part to work on the living a better life. So thank you again for joining us on our Talk with Terry Tuesday. We will see you next month at 1 p.m. on the second Tuesday of the month, September 13th. Thanks again. Okay, bye-bye.